Good morning. This is Sharon Huner, and you are listening to the introduction to week number 2 for NGC 502, Applied Informatics to Evaluate Healthcare Outcomes. This week we're really going to be focusing a lot more on transforming data into knowledge, and this is a really important thing right now in healthcare. There is, in fact, at the National Institutes of Health, a current initiative called BD2K, which is Big Data to Knowledge. And the Big Data to Knowledge initiative is really looking at using data science approaches to take information that is currently available and use it in some new ways. So it's a really exciting thing that's going on, and you're really starting to talk about just some of the early basics, but as we move through the semester, we'll have a whole lecture on data science and how it aligns with the Big Data to Knowledge initiative. In addition, in this content, in the new content section, we have a lengthy discussion about population health and how we use data about populations to understand healthcare. This is really important foundational information to the informatics exercise number 1, which we will be working on this week. So you really want to understand that background knowledge. We will continue to refer back to this information over the next few weeks. And also under the new content, there is going to be a video of me interviewing Elizabeth McLean-Plunkett, who is the supervisor at the primary care practice where we are implementing the coordinating transitions intervention. Now, I believe some of you may have seen some information about that in the past, especially in NGC 634, but this focus is going to be a little bit different. I'll talk very briefly about the 3 main elements of the intervention, and then allow Elizabeth to talk a little bit about her knowledge and what the experience was like and where they hope to take this intervention into the future. So some very exciting information there. Now, moving into the demonstration, there's a 30-minute demonstration of informatics exercise number 1. And what's going to be happening is we have 3 populations that we are interested in understanding over the next number of weeks, and I will do the demonstration on the privately insured population. That will be important data for you to remember and know. And in addition, there will be data available for each of you to do an individual assessment on. The individual assessment is going to be looking at your ability to reproduce the steps of the intervention on a different population. If you are in any of these subgroup A's, you'll be using the Medicare population, and if you are in subgroup B, you will be looking at the Medicaid population. Just a very brief reminder, for those of you who may not be familiar, Medicaid is an income-based insurance, which is where people need to show that they have income below a certain level in order to be eligible. And Medicare is a government insurance program that is available for people who are over the age of 65 predominantly. So in the demonstration, we'll talk about how to do this for the commercial population, and then in the task, there's a whole folder of materials that are available for informatics exercise number 1. The first is the rubric that we will use to grade the assignment. The second is, written instructions. Let's see, I can probably go in here. Okay, so in the materials for informatics exercise number 1, you'll see the rubric, and there are written instructions, and then there is the data for Medicare, which is for subgroup A, and the data for Medicaid, which is subgroup B. Now, in addition, in this folder, there is a, that's group 1, let's try here, group 2, there is some content on your informatics project, And what we'd like you to do is to set up a discussion board where group members can discuss their ideas and the topics that they're thinking about doing as they are considering improving their practice through informatics. That is not a graded assignment, but it's very important for you to start now being able to articulate what your experience is, and also what problems you identify and what kinds of ideas you might have about solving those. In order to assist you in doing this, last week there was a article, and it's coming up actually as required reading for this week, that the author is Suzanne Bakken, and it's called a Nursing Informatics Research Agenda for 2008 to 2018, Contextual Influence and Key Components. And it really is a very comprehensive overview of what are some of the key informatics approaches that people feel nurses should be involved in, and give some guidelines for why we're going to be looking at those things. So I think that this is going to be a really helpful article for you as you start to think about what kinds of informatics solutions are out there and how might I apply them to clinical settings. So that's an important piece. Now, also in the Digging Deeper section is a chapter in Alexander for those of you who are sort of really new to informatics. It's at a little bit more basic level. You can take a look at that. There's required reading for week 3, which is chapter 15 and 17 in the, go to here, I guess. That's week 1. Week 2, here's the required reading. So there's this is for required reading in week 3. It's chapter 15 and chapter 17 that we will be talking about more, and there's a paper that we're going to be requiring for week 4 that's in here now that actually will be moved to week 3, so you won't see this one. And finally, in week 1, I forgot to open up the survey on your experience using informatics tools, and so it's not a graded assignment. It probably will only take you about 5 minutes maximum to complete that. We'll be putting a link for that into the tasks page. But if you would please complete that so that we have some idea of what's the range of people's experience, and identify if there are some people who may need some additional support through the semester as they try to accomplish the different tasks that we're going to be doing. So I think that's it for our introduction to week 2. If you have questions, as always, please feel free to email me. I won't be available for appointments on Thursday or Friday of this week, but next week I'll be available for appointments, and I know some of you have taken advantage of that already. I will be responding to my email even when I can't get to my computer or have interviews. And Dr. Casucci is also available, especially if you have questions on how to do the informatics exercises. She's really quite skilled at using Excel and doing the different kinds of things, and should be able to help you with the interpretation as well. And for those of you who are having trouble accessing any of the materials in UB Learns, I suggest that you talk to Deb Zielinski. She's got the most familiarity with exactly what's being supported and how you need to access different materials. So yeah, sending an email to me about that will probably simply slow down the response time. So go directly to Deb if you have questions about accessing things in UB Learns. Thanks so much. Looking forward to getting more involved in applied informatics with you. Bye now.